Hello and welcome to Ask Your Academic. Today's session will cover the MSc Critical Care and the MSc Health Services Management. We're joined by some of our academics and a programme administration team today, and we may have someone else joining us too, maybe not. So thanks very much for taking time out of your day to join us. A number of questions have been submitted before today's session, so we'll do our best to get through all of those questions. If during the session you have any further questions, you can pop them into the chat box and we'll do our best to answer all of them. If you get any sort of questions specific to sort of funding or your application, I'll pop some useful links into the chat box too for you. We are recording today's session, so that will be made available to you after via email, and then it will be on the website too. So we don't have that much time, so if our panel could introduce themselves and give us a bit of an overview of their programme, that would be great. Who'd like to start us off? Conal, go for it.
Hello, can everyone hear me okay? Yeah. Hi, my name is Conal. I'm a doctor who works as a clinical teaching fellow in the intensive care unit in the Queen Elizabeth University Hospital. And I also am one of the faculty and clinical teaching fellow for the MSc in critical care. And then the MSc in critical care and leadership. So a brief overview of the program as well. Sorry, Naomi, you said, yeah. So the MSc in critical care is hosted almost exclusively at the Queen Elizabeth University Hospital in South Glasgow, but it's done in conjunction with the University of Glasgow. This program gives students the opportunity to study in depth a wide range of clinical sort of pertinent topics that are related to the area of critical care. Some of the courses that we run with things such as causes of multi-organ failure, management of multi-organ failure, sepsis, evidence-based quality improvement, and governance. So it allows students to really engage with those sorts of topics. The key sort of skills that this MSc is teaching is sort of academic and critical appraisal, critical thought, and the ability to critically appraise published research and apply an analytical approach. So one of the key courses we also do is based around research and scientific writing. This program should help enable successful candidates and those who complete it the opportunity to become sort of a mini specialist in certain areas of critical care and areas that they might find interesting to themselves. So that's kind of a brief overview, but we'll get a bit more into the details with the questions. Thank you.
Hi, I'm Natalia Jonsson. I'm the administrator for Health Services Management and the Critical Care programs, and I'll be happy to answer any question in relation to the structure of the programs, on the application process, and any program-related inquiries that do not concern the specific academic content.
Thank you. So we're always asked about the project element of the programme. So can you both sort of tell us a wee bit more about how students select their title, how they select their supervisor? Is it from like a list of titles provided by academics, or do they choose their own?
Yes, so the MSc in critical care, in the third semester, you will do a dissertation project, which is worth 60 credits. It usually takes the form of one of two sort of types of projects. The first one, which is the much more common one, is a literature review around an area in critical care. The senior faculty are quite supportive of any topic that you have interest in. So you're not restricted to any area of critical care. They're actually quite liked whenever students come to them with an area that they're interested in, and when a student can get in contact early and they can discuss the feasibility of how easy or difficult that may be to do. For example, if you were to pick a research question that was very broad and be very difficult, the faculty can help you keep the same topic, but can hone in and just sort of focus your research question to get to something that's a bit more manageable. Conversely, if it's something that's a bit too narrow, they can help you expand that, but they'll very much try and support your area of interest. So, and so it's pretty open to the students to make their own, to bring their own interest into it. However, there is guidance there. If students are unsure about what they want to do, then the supervisors are quite happy to help sort of provide inspiration for what they might want to do. The other format that sometimes can be supported is that if students want to do empirical research project, so not necessarily literature review, but actually do a project themselves, it is sort of cautioned that this can be quite difficult with the time constraints within the 1 year of the MSc program to be able to fully develop, design, and run and complete the project. But it is something that is possible. Again, this will be reiterated many times within the course. If that is something that the students are interested in, they're encouraged to get in touch with the senior faculty early, and they will have discussions on whether that's possible with the topic that they want. If it is, then they will try and help that happen. But sometimes it can be difficult within those restrictions. Sorry.
No, your sound just went a little bit robotic there, but look like we've got you back, I think.
Okay.
Must just been the signal dropped.
No problem. So there's in summary, there's two different formats. It's pretty open to the students, but there's lots of guidance. You had also asked the question about dissertation supervisors. There's lots of senior faculty on the program, and they get assigned, if the students have an idea roughly of what area of research or what type of research, for example, qualitative, quantitative, or a specific area, we ask them to nominate or to let us know that early so that we can assign a supervisor who has a bit more experience or a bit more interest in that area. So we will assign a supervisor, and hopefully based on the area the students are likely to be completing their project in.
Perfect, thank you. And Natalia, is that the same for the Health Services Management Programme in terms of choosing titles?
Broadly, yes, it is the same. We work closely with supervisors across different schools and departments within the university, so students do have the full freedom to choose their own topics in consultation with a program lead. So there will initially be a series of consultations with a program lead, and then students will be assigned supervisors depending on their interest. All of the projects that we support, they are non-clinical. There will be no clinical placements as part of the projects, as there will be, so all of them will be mostly literature reviews and analysis of existing research. And what we usually try to do is, almost from the very start of the program, we offer a series of guidance sessions, additional sessions with the program lead on different aspects of the preparation for and working on the dissertation projects, regardless of the specific topic that a particular student may have chosen or is going to choose.
Perfect, thank you. And then we were asked a little bit about assessments. So how are students assessed throughout their MSc? Conal, do you want to go first?
Yep. So there's usually 2 summative assessments per course. So there's a total of 6 courses before the project, and in each of them there's 2 summatives. It's for the critical care program. One is usually an essay that makes up the vast majority of the around 80 to 90% of the summative mark, and then the other one is a supplementary with 6 different formats. The essay has different themes. So normally, to begin with, it is critical appraisal skills, whether that's appraising literature, appraising 1 or 2 research projects relevant to that course. But a bit later on, it could be around developing a quality improvement project, for example, in the evidence-based quality improvement. So that's the sort of larger essay component. The supplementary, in each course, it can change slightly different. Sometimes it will be a presentation. So roughly a 5-minute presentation. Sometimes it will be an exam, a written exam. Other times it may be a simulation session based on sort of a simulated patient and simulated skills. So the vast majority will be essay based, as Natalia says, and a lot of it will be testing academic skills. Within every course, whatever the format of the summative that we give, there will be a formative version of that. So if there's a presentation that needs to be done as a summative, there will be a formative presentation earlier in the course. We always mirror it, so it gives the students the opportunity to learn, to practice, and then to get feedback and bring that to the summative.
Thank you. Natalia, is there anything you'd like to add?
Again, broadly, it is very similar on health services management, with an important addition, the fact that our program is structured in a way that ensures that our students can take courses across different schools and departments. For example, the School of Management and the School of Social and Political Sciences, in addition to our own medicine and nursing. The range of assessments is similar to what Conal has mentioned. Presentations, mainly essays. Sometimes there are posters, sometimes there is group work, mostly they're individual. However, there will always be formative assessments. Formatives are the ones that are practice assessments. They're not marked, they're just for practice, in addition to the summatives, which are the ones that are really marked for real. And we do not have any what is called in-presence exams. That is, people do not come and sit in a big hall and write their essays or answer multiple choice questions. So whatever exams we do have will be online, but mostly it's presentations, posters, and the vast majority are essays. This, however, may change, but at the moment, that's the way it is.
Thank you. I will say that on our website for each of the programmes, you will find under programme structure links to the different courses, and in there it sometimes gives you a wee bit more about the different assessments for each of those courses. So that's quite a useful bit to look at for more information too. We're always asked for an MSc how much sort of class time do students have versus what's expected of them out with. So I know there's no such thing as a typical week, but how many hours worth of classes can students expect to be in per week?
Yes, so all of our on-campus classes are done on a Tuesday or a Thursday normally. So full day Tuesday, half day Thursday, and all take place in the Queen Elizabeth University Hospital. Normally there's between sort of 4 or 5 hours on a Tuesday and about 3 hours on a Thursday. And that's a sort of typical week, but obviously, as you said, there's variations depending on what time of year, what the course is, different things like that. And they tend to sort of say sort of the number of hours in class, the number of hours out of class is sort of like 10 hours in classes to 100 hours of self-directed work is kind of what's guided for these MSc programs. So that would be a sort of a rough week. But all the classes almost exclusively are done on Tuesdays or Thursdays.
Thank you. And for health services management, Natalia, is that similar?
In terms of the requirement for independent work versus frontal teaching, it's exactly the same as what Conal said. Yes, so for a 10-credit course, you should expect something like 10 hours of frontal teaching and something like 90 hours of independent study. That's, of course, a rough guide. In terms of the presence on campus with health services management, it very much varies depending, especially in the second semester, depending on the courses you choose, as some of them are online and some of them will be taking place on different days of the week. In the first semester, it depends on the tutorials you will be taking with the Adam Smith Business School, because their tutorials take place on different days of the week, so the timetable will vary for different students. But for the in the first semester, there are no online options. In the second semester, with the electives, people who prefer some flexibility, may choose online electives, and sometimes the lectures, they will be pre-recorded, so they will not have to be attended live. That will give some flexibility.
Thank you. And for health services management, are most of those classes based on the main campus?
For health services management, all of the classes will be based on the main campus in Glasgow, yes.
Perfect. And then you've already kind of touched on this, but just to clarify, is there any practical work involved in either of the MSCs?
For the critical care MSc, there is almost zero. So it's very, very much based around academic skills and critical appraisal and research analysis. There are some small areas or some small sessions, for example, some bedside teaching, some simulation that is done to supplement that. And that will be done with one of the senior faculty within the critical care program. However, that's very much supplemental and is a small focus. The vast majority of this would be not patient contact, and it would be sort of academic skills.
Yes, again, exactly as Conal said, with health services management, it's a purely academic program. We do not offer, we often receive questions or requests from students or potential students regarding the possibility of job placements or contacts with the relevant industry. We are not able to offer any guidance on that. We do our best to suggest networking events, conferences that might be of interest to students, and similar options for promoting themselves as professionals in the field. But the program itself is academic only and does not involve, imply, or require any practical work in the NHS or otherwise.
Perfect, thank you. And another one we all would ask is there anything that students can do to prepare for starting their studies in September? So is there any recommended reading or things they could be doing before they join?
First course is research and scientific writing. It's one of the courses people find sometimes a bit more difficult because it's a real fundamentals of your academic skills. And that's the thing, because a lot of the students we get tend to be clinically based, so they're more comfortable when it comes to the clinical side of things. You will be taught extensively on the course, so there's no if you've been accepted or received a place, then there's no you have to read this or have to read that. But something that could like you could do in preparation to help for the first course would be to have a look at some of the academic resources on the Glasgow University website, because they offer quite a lot of really good resources for postgraduate and academic students. So that would be something you could have a look at to help get yourself started, because I know the first course can sometimes be a relatively steep learning curve. However, that's not expected. We'll be expecting to teach everyone from entry level up.
Right. Again, very much the same for health services management. The program structure is slightly different there, so there is one introductory course, but otherwise there is such a range of subject covered with electives that it's actually quite difficult to guide the students with their pre-program reading. It very much depends on their particular professional background. I do send out a welcome letter to all our candidates regularly, those who've received unconditional offers. And there is a reference there to one particular source that the students are encouraged to familiarize themselves with if they have time, but even if they don't, that will be absolutely fine. They will receive lots and lots of support sessions throughout the program. And again, as Conal said, we will guide them to a variety of university resources to which they will have access once they are fully registered students.
Thank you. And do you know what sort of graduates of the programme, what kind of jobs they go on to do?
Yeah, so for the critical care program, we've quite a varied professions that come into it, from respiratory therapists, nurses, physicians, pharmacists, OTs, dietitians. Going by this year, there's been a few of the students have prepared PhDs to go on and do further study and sort of further academic and work that way, with the aim to have academic jobs in the future back in their home country or over within the UK. Some of the other students have taken the skills they've learned and gone back to their own department and use that to help develop their own department and help rise up in the job prospects there. And I know that if applying to jobs within critical care or anaesthesia within the UK, certainly for physicians, but also for other health professions, this is something that can support applicants a lot.
We usually advise our students to look for employment opportunities based on their undergraduate degree, because the masters we teach will be very much targeted towards their professional interests, again, with a variety of electives, the options that we offer. So that this should probably be the directions in which everybody should be thinking, coming from their undergraduate degree plus the health services management masters or diploma or certificate they will acquire with us. We have had a variety of professionals on the program, from pharmacists to doctors to managers to reflexologists, lots and lots and lots of people with different professional backgrounds. And we've had people finding jobs from major UK and international charities in senior positions to the United Kingdom Parliament in Westminster, to just people, like Conal said, going back to their previous jobs, but simply probably advancing in their careers thanks to the skills they will have acquired with us.
Thank you. Both programmes sound very varied, so that's really good. We are just approaching the end of our session. If you do have any questions, we do have time to take a couple more, so please use the Q&A box or the chat box to pop them in. Just before we sort of finish up, is there anything that we've not covered that you think is important to say, or anything that you would like to add? Yeah, quite happy.
I would just like to add that I welcome emails, questions, even on a daily basis, 10 times a day. Hopefully that won't happen. But if you feel like it, please do feel free. It never makes me angry and upset. It always makes me happy to be able to offer advice or to be able to direct people to somebody who can maybe help. So please do not even think twice, just email whenever you have a question.
Thank you. I will just clarify that, because I often email questions to many of our administration teams, a lot of them very silly, and they are always more than happy to help. So yeah, they are really a great resource, and they are always very good at getting back to you with useful information. We don't seem to have any sort of questions coming through, so I think that we'll take that as a good sign that we've covered off all the main points there. So just thanks very much to our panel for taking time out of your busy day. We hope you found that session useful, and like Natalia has said, if you do have anything that you'd like to follow up with, please just get in touch. You can find the email address for our administration teams on the programme web pages of our website. So yeah, so that's us now at the end of our session. So thanks very much again, and we hope to see you all in September. So thank you. Bye bye.
Thank you. Bye.